this course. We talk a lot about marketing. Marketing can be done a certain way that's effective. You can market the wrong way and you can waste a lot of money. The next component of the course is new patient management, which is quite simply the most important component of your practice. How you handle new patients, how you bring them into practice is key. And we'll take a patient and we'll walk them through the whole process, from the phone call, to the initial consultation, to the exam, to the treatment plan presentation, to how to do the financial arrangement and close the whole deal. I mean, you can do a lot of these cases if you don't want to get paid for them, but after a while that's not going to be any fun. So getting paid for these cases is really, really, really important. The next component that we talk about is treatment sequencing. What I mean by that is these cases are very complex and the steps need to be done in a certain order to get a very good, efficient, and effective result. If you sit down for a couple minutes and figure out how to do the case in a certain order that makes sense to you, you can save a lot of time, save the patients a lot of time. And don't think that the patients like coming to your office. If you can get the case done in half the time, you're a hero. They'll even pay more for that. So more time does not equate to more value in the patient's eyes. Also, we're going to talk a lot about bite management. We're going to talk about the different types of bites and occlusions that walk in your door and how to handle each one of them. We're going to talk about how to do centric relation cases to a very high degree of precision. Not really, I'm kidding. We're not going to talk much about centric relation at all. We're going to talk a lot about centric occlusion. We're going to talk a lot about neuromuscular. Neuromuscular is definitely where it's at on full mouth cases, because how else would you do them? There's a few tips and tricks that we can pass along that will make doing neuromuscular dentistry work a lot better. Neuromuscular bite management, really key. We're going to spend a lot of time talking about how to take bites that optimize not only occlusion and function and physiology, but how to optimize the facial aesthetics of the patients. What I found is that what really sells these cases is how the patient's face looks after you get through with the case. And if you can learn how to take a bite to make the patient look 10 or 15 years younger, they're going to really like it. So if you can optimize the face, optimize the bite, optimize the physiology, optimize their smile, you've got a product and a service that nobody else on the planet has. And if you can hit the patients in all four of those categories in a positive way, you're going to do a lot of these cases and you're going to get really good at it. The laboratory diagnostic phase is the next session, the next segment that we'll be talking about. Talk about how to choose a lab, how to communicate with the lab, how to do simple smile designs. We're going to talk a lot about the things that LVI teaches, but we're going to throw in a few little tips and tricks on how to make what LVI already teaches more powerful. The next phase is the preparation phase. We'll show you how to get through a prep full mouth in 3 or 4 hours predictably every time. There's certain things you can do that will make this process go faster, and there's certain things you can do that won't. There sort of seems to be a physiologic time window for most patients. Most patients hit the wall somewhere around 4.5, 5 hours. I mean, they just can't take it anymore. The dentist can't take it anymore. So if you can get your case in and out, done, prepped, in 4 hours before the patient just gets totally wiped out, the case is going to turn out a lot better and you're really not fighting them anymore. It also helps you learn how to schedule these cases better. I mean, you really don't want to schedule a case if you don't know how long it's going to take to prep it in the middle of the day, because you're going to create a train wreck for your office. Lots of tips and tricks on the preparation phase. The next area that we're going to talk about in the course is case verification. A lot of dentists I've noticed wait till the patient gets in the chair and then they try in the case in the patient's mouth. Well, if it doesn't go very well, the patients are thinking, well, why didn't you just try it in or check this thing out before I got here, and why are you wasting my time? We check the cases in the lab, and we know how the case is going to fit based on certain criteria that we used to check the cases in. We know how they're going to fit before we even go to the patient's mouth. As a matter of fact, when we go to seat a case, that's what we do, is we seat it because we already know how the case is going to turn out. If the case doesn't meet our certain quality standards, then we're going to send it back to the lab and have them fix it, redo it, whatever it takes. So you really don't need to try these things in the patient's mouth. Try them in ahead of time. We'll show you how to do this.